Hi, today let us discuss a topic that is challenging to all parents of young children, but more challenging to parents of children with autism. This is toileting or toilet training. Why is this challenging to parents of children with autism? This is because information and techniques that apply to neurotypical children may not apply to children with autism. But it is still important for parents of children with autism to continue with toilet training. Why is this so? For two reasons. One, this ensures a feeling of self-respect and independence in the children in the long term. And second, it makes them less vulnerable to abuse if they are independent in this area. Let us look at the barriers to toileting of young children with autism. First, motivation. Children with autism are not motivated by social feedback. Pleasing parents or obliging them do not encourage them to meet their parents' expectations of toileting. Communication problems. Learning to use the toilet involves following verbal directions which do not come naturally to children with autism. Difficulties with receptive language and pedantic speech causes difficulties to children with autism. Expressive language challenges may make expressing the need to use the toilet challenging to children. Fear of change. A new toileting program is a change in routine for a child with autism, and children with autism resist change. Children with autism are coping with unusually high levels of anxiety, and introducing a new toileting program adds to that level of anxiety. Basic impairments that come along with autism could keep a child with autism in nappies much longer than their neurotypical peers. Sensory issues. Sometimes the child is unable to sense that their bladder or bowel is full and therefore does not need to go to the toilet and end up having an accident. The child with autism might actually like the sensation of having a full diaper and see no reason to give it up. Some children with autism do not like certain physical aspects of the bathroom. For example, the smell of the toilet, the smell of the cleaning agents used, the sound of the flush, the pressure of the water of the health spray, and so on. Public toilets may especially scare some children, as the sudden roar of a hand dryer can be an unbearable sound to them. Gastro-intestinal problems. Chronic diarrhea or constipation, inflamed or irritable bowels, gastroesophageal reflux disease. Practitioners point to the leaky gut, but there is not much evidence to that, and the pain and discomfort that is associated with GERD not only is a challenge to toileting, but also affects their general sense of well-being. So now, let us look at the steps required for preparing your child for toilet training. The first step is to realize that parents should look at it as a step for communication and working together with your child. It might also help to think of toilet training as a series of small steps rather than one big goal. For example, start with simply familiarizing your child with the toilet, how it is used, what it is for, and then progress to starting toileting. Now, let us look at toilet training strategies for children with autism. Toilet schedules. Why is this important? First, it helps to give predictability to children as to when they are most likely to urinate or have a bowel movement. Predictability for new behavioral expectations. You can record the times of your child's urine and bowel movements for a day for a whole week. From this, the natural patterns of elimination will become evident. And this will provide a clue to you about the average time that your child is able to stay dry. This will then determine the appropriate times to bring the child to the bathroom. Now, let us look at some encouragement and rewards that can be used in your toileting program. you could use a descriptive praise. For example, Gautam, well done for sitting on the toilet. You can use non-verbal praise and gestures such as clapping or a thumbs up sign. You could use a favorite activity. For example, a playtime with cars or trains, etc. Sometimes a star on a sticker chart will work. A favorite healthy food is always an option. Please try a variety of rewards and use the ones your child responds to best. Remember that some rewards that might interest a neurotypical child, like stickers or stamps, might not be of interest to your child with autism. Also, remember that once your child has made a progress on a particular step, stop using food, activities or toys as rewards, but continue using verbal and non-verbal praise. So now let us look at some visual supports that can be used in your toileting strategy. Child's learning can be supported by providing visual cues and prompts. This is especially true for children with autism because visual cues help to reinforce the routine of using the toilet. A visual schedule, for example the one used in a picture exchange communication system, can be provided to show your child the toileting routine. The schedule can be stuck on a wall close to the toilet or potty. Go over the schedule with your child 2 to 3 times a day. Let us look at the role of social stories. Social stories are used to help children with autism develop appropriate behavior and responses and help with challenging or confusing situations like toilet training. Social stories help because they use simple storylines with clear pictures. They should be written from your child's perspective. They should describe the situation, like using the toilet, give details about what happens in the situation, suggest how your child might respond in the situation, and explain why your child should respond in a particular way. Now let's look into some of the strategies that may be used to tackle the sensory processing difficulties that occur while toileting. Olfactory, that is to do with the sense of smell. The problem areas would be the smell of the pee or the poo, the soap, the smell of the wet wipes with fragrance or other scents. The solution to this kind of problems would be to use unscented cleaners, unscented soaps, or your child's preferred fragrance of air fresheners. The second type of sensory processing difficulty would be visual. And the problem areas here would be the use of bright lights or the opposite, the darkness in a toilet. The solution would be to use soft lighting or warm lights in your bathroom. The third kind of sensory processing difficulty belongs to the tactile area. So this would be the touch and feel of your toilet seat, soap, fabric, etc. The solution to this would be to use padded toilet seats, use of foaming soap, use of wet wipes. Proprioceptive or vestibular difficulty. The child has a problem with the feet dangling off the ground. And the solution to this problem would be to have a footstool for stabilizing the feet. The fifth type of sensory processing difficulty would be auditory. And the problem area here would be the sound of the toilet flushing or the tap opening. A solution would be to play music to limit the auditory input. Now, how do you deal with toileting accidents? Always have an accident kit in hand, which consists of wet wipes, underwear, a plastic bag, and a change of clothes. Use a neutral tone while talking to your child. Do not use a tone that makes your child fearful or anxious. Have your child change his clothes near the toilet or close to the toilet. Involve your child while cleaning the area of accident. And finally, things to remember. Manage your expectations. Keep your expectations realistic and according to your child's ability. Keep in mind that accidents are okay. Just prepare yourself to manage a toileting accident. Your child might regress along the way, but that is okay. Toilet training takes time. Make sure that you and your child are ready to start, and plan and begin with small steps. Be patient. The journey might take a while, but it is worth the wait.